Hi, my name is Missy Chase, and I'm a veterinary nurse coordinator for the Veterinary Medical Technology program. The purpose of this presentation is to give an overview of veterinary medical technology for those interested in pursuing this career. First, we must ask, what is veterinary medical technology? Let's first distinguish the difference between a veterinarian and a veterinary technician. Veterinarians diagnose disease, prescribe medications, and perform surgery. Veterinary technicians are the support system responsible for aiding in the diagnosis of disease. They provide nursing care, prepare surgeries, monitor anesthesia, and are advocates for the patient's health and well-being. The duties of a technician are extensive and an integral part of the veterinary team. Students will gain experience with many different species of animals, so cows, goats, chickens, horses, dogs, cats, rats, mice, rabbits, lizards, amphibians, wildlife, you name it. The program provides a comprehensive overview of animal care responsibilities for all species students may come into contact with in the veterinary industry. Having program animals in the veterinary technology facility provides a unique learning experience where students can study animal behavior and the human-animal bond, provide basic animal care, practice animal handling and restraint, and provide therapeutic medical care. Weekly physical examinations are completed by the students, which gives them an opportunity to start recognizing normal and abnormal vitals and identify issues with an animal as they arise. Blood work, fecals, urinalysis, ear and skin cytologies are just a few of many diagnostics performed on the animals based on their individual needs and symptoms. Students will learn how to accurately and thoroughly complete medical documentation, and animals will receive routine prevention by the students such as vaccinations, heartworm prevention, and flea and tick prevention. Students will create a personalized diet for each animal based on their individual needs and receive animal nutritional training. Students will be assigned kennel duty for routine feeding and exercise and cleaning up after the animals. We have a fear-free approach at JJC, meaning animals will be trained with positive reinforcement and students will provide enrichment for them. Students will also fill and administer medications on an appropriate schedule, and they will be responsible for preparing for surgery, assisting and monitoring anesthesia, and post-surgical care. Surgery class prepares students for surgical monitoring and anesthesia in practice. And students will form close bonds with the program animals and work hard to promote adoption events at the end of each semester. Nursing care is alleviating suffering, preventing further illness, providing safety, and promoting health. Students will learn what is normal and abnormal in regards to an animal's health. The combination of clinical signs, animal history, and physical exam information can key the veterinarian in on the next step in veterinary care and diagnostics. Veterinary technicians are advocates of client education to make sure owners know the why. So the program will teach individuals how to educate the public about heartworm prevention, flea and tick prevention, vaccinations, disease, behavioral training, nutrition, and animal well-being. Classes are centered around appropriate nursing care and monitoring of surgical or critically ill patients. Veterinarians will prescribe medications while these students will fill and administer medications for all animals housed in the program. Blood, fecal samples, urine samples, and skin and ear cytologies will also be performed for diagnostic evaluation by the students. Additionally, students will become advocates on animal dental health. The curriculum will discuss periodontal diseases, gingivitis, oral masses, and dental charting. A lot of the dental instruments used in human medicine are also used for veterinary dental cleanings. The small animal nursing course will cover dental instruments and their uses. Students will perform supervised dental cleaning procedures and document tartar and plaque buildup, missing teeth, diseased teeth, and overall periodontal health on their patients. Throughout the course of the program, students will take courses centered around sample collection for diagnostic evaluation. These courses emphasize proper technique for collection and examination of many different samples that will aid a veterinary team in diagnosing and providing therapeutic treatment. Individuals enrolled in the veterinary technology program will establish techniques for safely collecting and handling blood, fecal, urine, and skin samples. microscopic evaluation, and use of laboratory equipment will be taught extensively. As previously mentioned, microscope use and evaluation are emphasized in the curriculum for diagnostic aid to the veterinary team. Clinical pathology will provide students with knowledge of a variety of diagnostic tests as well as laboratory equipment and its uses. They will be able to identify the normal and abnormal qualities in a variety of samples. The class will read fecal samples to identify different parasitic eggs, many of which are infectious to humans. Blood sample analysis can give a lot of information that leads to diagnosis of disease or illness, and students will learn to differentiate different blood cells and quantify them. Urinalysis findings will aid in the diagnosis of urinary tract infections and illnesses. Skin cytologies will indicate the presence of infection or microscopic mites, and ear cytologies will indicate the presence of bacteria, yeast, and mites. Students will also learn different positioning terms that are necessary for correct identification of anatomy on a radiograph. Low stress handling is practiced frequently at Joliet Junior College, so each radiograph is taken with as little stress to the animal as possible. Personal protective equipment will be utilized by all members of the program. Students will capture images while protecting themselves from radiation with a thyroid shield, lead gloves, and a lead gown. The diagnostic imaging course will focus on developing quality images for interpretation while maintaining student and patient safety. Students will also assist in anesthetizing and maintaining anesthesia for surgery. They will set up the surgery room and hook up the anesthetic machine and all of its components, prepare for catheter placement and intubation of an animal for surgery. Students will also calculate and administer the proper pre-anesthetic drugs, maintain patients on gas anesthesia, and provide postoperative pain control. Technicians are advocates for an animal's well-being, so while the doctor is focused on surgery, the veterinary technician needs to be focused on maintaining a level of anesthesia that is appropriate for the procedure being done. The class will use a combination of vital signs, reflexes, and knowledge of medications and gas anesthesia to make sure the animal is appropriately anesthetized. Students will anesthetize animals under the veterinarian and staff supervision, so preventative surgeries may be performed, and will recognize situations that may need medical intervention. Students will be trained for emergency situations in which life-saving therapy may be needed. Medical documentation is also emphasized in the learning process for all procedures done at the facility, especially surgery. Students will understand aseptic technique in maintaining sterility while taking their second surgery course. Knowledge of surgery preparation and instrument identification will be gained in the class and will be applied with hands-on learning. The veterinary technician's role in anesthesia is extensive, but some routine tasks may include pre-anesthetic preparation, evaluating patients, giving fluids, administering anesthesia, managing ventilation, maintaining sedation, monitoring emergence from anesthesia, post-anesthetic care, performing equipment maintenance, and providing hands-on assistance when needed. Successful practice of anesthesia requires a great deal of knowledge, commitment, and acceptance of responsibility on behalf of the technician. A veterinary technician accepts a personal responsibility for the well-being of the patient before, during, and after any procedure or surgery. So now we're going to talk about some of the career opportunities that are available for our graduates. They can go into companion animal medicine, which would be for our dogs, cats, rodents, rabbits, and any other household pets. So individuals interested in working with those animals would look for a companion animal hospital. Students can also continue on their education to specialize in many different avenues, such as surgery, internal medicine, equine medicine, dentistry, emergency and critical care. There are many other specialties to look into. For individuals that are interested in emergency, that would be our critically ill and, of course, emergency patients. For large animal, those individuals would often be working with farm animals, including cows, horses, goats, sheep, pig. Laboratory animal, those individuals would be assisting veterinarians and researchers with animal restraint, basic husbandry, diagnostic testing and enrichment, and collecting and analyzing data. For those that are interested in exotic animal, that's often our zoos, wildlife rehabilitation centers, and aquariums. For pharmaceuticals, we do have a lot of individuals that graduate the program and become veterinary product representatives or go into pharmaceutical sales. Can also go in the education route. So licensed technicians can work for a veterinary technology or assistant program. And individuals that may want to work for the government can work for the USDA for food testing and inspection. These are also some other avenues that technicians can look into after graduating the program. Many hospitals will offer these services. So rehabilitation would include electrical stimulation, massage, traction techniques, passive range of motion exercises and stretches, hydrotherapy, balance and strengthening exercises, and speed and agility work. These are typically for animals who have had some kind of injury that may have reduced their range of motion. So you can see in the left picture that animal is receiving hydrotherapy. Acupuncture is practiced in a lot of different hospitals as traditional oriental medicine. And chiropractics is a field of animal health care that focuses on the preservation of and health of neuromusculoskeletal system. The reason why, of course, is because nerves control everything that happens in our animals. So if anything is adversely affecting the nervous system, it could have detrimental effects on that animal, just as it does in people. So just a list of some prerequisites that are required for entrance to the program. So Math 094 to be completed or placed above, medical terminology, principles of biology, any other general education course, an English course, a social and behavioral science course such as psychology or sociology, and a communications course. It is based on a point system for entrance to the program, so a portion of that is GPA, a portion of that is veterinary experience hours, so getting out there and volunteering at your local animal hospital. We do also offer LLC 119, which is a class of field trips, and veterinary assistant certificate programs do award students more points towards application into the program. So the program is a 2-year program, including breaks and summers. It has day and evening sections, and it does have part-time and full-time. Part-time must be completed within 4 years. The VTNE is the national board exam that students will take after completion of the program. And they will complete continuing education every 2 years to keep their license current. For those transferring out of state, there are different general education requirements for each state, so that's something that an individual would want to look into when they have an idea about moving to a different state. And then the ISVMA and the AVTE. So the ISVMA holds a great conference every year that offers a lot of continuing education for our licensed students. So the first program, freshman year, has a variety of different classes, as you can see, that will be offered for that time. There's also a freshman summer externship where the students will be able to go out into practice and practice those hands-on skills. Year 2 of the program is a little more intense. So we have our Surgery 2 class, Exotic Animal Nursing, Clinical Pathology 2, Kennels 3. Capstone class kind of brings everything together, and Large Animal Nursing as well. The spring externship is the final externship prior to graduation, so the students will get one more chance to work and practice and get those hands-on skills. And then the elective study abroad, which in previous years students have gone out to Guatemala, Belize, which is still pending on the status of the national COVID crisis. And of course, at the end of each semester, we do our program animal adoptions. So all of our animals are available for adoptions to students and the public. The animals are all spayed and neutered. They're microchipped. They're updated on vaccinations and preventative care. They're being treated for or were previously treated for illnesses acquired before or during the program, and they're socialized with people and other animals if able. Additionally, they are shown at adoption events as well, which once again would be pending on the COVID situation. And of course, the Vet Tech Club, the students participate in every semester and every year. The students in the program are also members of the Vet Tech Club, so they'll participate in fundraising events for the animals in the program. They educate the public on veterinary technology and promote open house and adoption events. Thank you for the presentation. If you have any questions, please feel free to reach out to the Veterinary Technology program for more information. Thank you.